Our lovely patient, who's 57 years old, is about 2 weeks out from her abdominoplasty, and she has very graciously agreed to share with us some of her thoughts and feelings about why she did this in the first place and how she feels her recovery is going.
I'm further along than I thought I would be at this point. Very happy with the results that I've seen. I can't wait for all of it to heal so I can go be my best self at this point. But one of the biggest things that brought me here was constant lower back pain that physical therapy, my chiropractor, and other people kept saying was to tighten my core because I have herniated discs. And I continued to do that through the years, and the more I tightened it, the worse my discs got because there was nothing supporting it. And apparently I saw Dr. Clater, and the reason was because I had no core. So my hope, and so far in the recovery, which I expected at this point, was a lot of back pain with this recovery. My chiropractor told me that, just because the way you have to lay and the way you have to lean afterwards. I have not experienced any of that, and it actually feels strong. So I'm very pleased.
Awesome. And we were able to do your procedure, as is my standard protocol, without any drains. Has that been a positive for you?
Well, I believe so. I have heard of other people having drains, and I don't know what that looks like or feels like, but it was one less thing I had to worry about in the recovery. I just feel like I didn't need one more thing, and everything's just been so positive. I feel great. I really feel great. I feel happy. The first 3 days were rough, but as Dr. Clater promised, I just had to hold tight, and I'm so glad I did, because with anything, you have to have a little pain before gain, and I can't wait to get back to my normal self.
That's awesome. So far in the process, is this something that you would recommend to a friend?
Oh, absolutely. Absolutely. And it's so funny because it took my younger sister to be the one to push me to do this. She had known people who had done it. And I was reluctant for many reasons, mostly because I didn't want people to think I was doing something, for vanity reasons or whatever. But it was bigger than that for me. And I just feel like this is going to now finally complete me, the pieces that were missing, that were bothering me all these years.
Well, I'm so very happy for your recovery is going very smoothly, and thank you for your kind words.
Thank you, Dr. Clater. I'm very happy.